Hey guys, welcome back to a series of case-based scenarios. In this video, we are going to see about factors affecting mandibular denture stability. Okay, from the subject Prosthodontics, and this is Dr. Janvi here. So let's just begin with our topic now. The factors affecting mandibular denture stability are, so these are categorized into three categories as you can see here. So the relationship of the denture base to the underlying tissues, number one, and number two, the relationship of the polished surface and border to the surrounding orofacial musculature, and number three is relationship of the opposing occlusal surfaces. So we'll just see how what and all are involved in these factors to be maintained. So relationship of the denture base to the underlying tissues is maintained by the fitting surface or intaglio surface or impression surface, and also by residual ridge factor. So how these maintain this relationship? Let's just see it. Fitting surface or the intaglio surface or impression surface is nothing but the surface on which we take our primary and the secondary impressions for our denture making. So the complete denture should cover the maximum area possible along with close adaptation to the underlying surface. So the various modifications in the design of the denture in resorbed ridges are, so as you know, we make complete dentures in the people who have lost teeth. So once they lose teeth, what happens? The ridges get resorbed over time. Okay, so for that, to achieve a maximum stability, the denture should be made in certain way so that we can achieve the maximum stability. So the first thing we modify is the lingual flange design or the sublingual crescent extension. So it involves a lingual wing placed in a biologically accepted fashion by increasing the area of denture. So as area increases, the retention and stability increases. And posterior lingual extension. So as you know, the posterior part of the alveolingual sulcus divides into two parts. So the mandibular denture, the posterior part of the alveolingual sulcus divides into two parts, that is antero-inferior part and posterior-superior part. Okay, so the lingual flange should be turned into the antero-inferior part to produce the maximum stability of the denture, since no muscle lies directly underneath it. Okay. Then the residual ridge factor. So how does this involved in maintaining the relationship? So height and width. The height and width of the denture is very important. So it is directly proportional. The stability is directly proportional to height and width. Resorbed ridges have poor stability. The ridge shape and size. So stability increases in square shaped ridge, parallel sided broad ridges than in small narrow tapered ridges. Then the interarch space, appropriate vertical dimension enhances denture stability. Then the ridge parallelism, parallelism of the edentulous dentures favors seating of the denture bases during the tooth contact because of the favorable directions of forces. Okay, that increases the stability. Then ridge relation, the denture stability is a problem in severe prognathic and retrographic ridge relations. Okay, so severe prognathic and retrographic ridge relations should be taken care of. Then the ridge quality, denture stability becomes decreased by the presence of hypermobile or flabby tissue on the ridge surface. We know that. So the relationship of the polished surface and border to the surrounding orofacial musculature. So let's see what all factors are involved in this. So the polished surface of the mandibular denture extends from the denture border in the vestibular depth upwards to the occlusal surface of the teeth. So as you know, so this is the teeth. Okay, so this is the polished surface. Okay, so the surface which we polish finishing during the finishing of the denture is polished surface. So it should be shaped to accommodate the musculature contacting the surface around the denture, which in turn aids in denture stability. Okay. Then the role of Modiolus. So do you know what is Modiolus? Right. So the Modiolus is a tendinous node It is an anatomical landmark near the corner of the mouth. So we have an Instagram post regarding Modiolus in our Instagram. So if you have any doubt, you can just go check in our Instagram for this. So it is formed by the intersection of various muscles. So as you can see, orbicularis oris, depressor anguli oris, levator anguli oris, quadratus labii superioris, quadratus labii inferioris, buccinator, rhizorius, and zygomaticus major of the cheeks and lips. Okay, so the mandibular denture base must be contoured to permit the modiolus to function freely. So the modiolus has to function freely. Okay, so when it functions freely, then only the denture will be stable. Then only the person will be able to talk properly, eat properly. Okay, so modiolus is a very important part to be taken care of. Okay. Then coming to the role of frenum, as you know, the frenum should be relieved. So it is not a muscular structure, should be permitted adequate space. So otherwise it will result in dislodgement of the denture. Then relationship of the opposing occlusal surfaces. So the occlusal surface, you know, there are teeth. We have placed teeth. So the denture should be fabricated so that all the posterior teeth have simultaneous contact in the eccentric positions as well as in the centric relation. That is, they should have a bilateral balanced occlusion to provide proper denture stability. Then tooth position should be as close as the position previously occupied by the natural teeth. The occlusal plane, so the best stability when the occlusal plane is parallel and anatomically oriented to the ridges. Okay. Then apart from these relationships, we have other factors also which help in securing the denture stability of a mandibular denture. So let's see what are they. A patient muscle control and coordination. Okay, this is very important. So a well coordinated patient will usually manage even if the dentures are not retentive and stable. These patients are called as oral acrobats. So this is a very important term. So oral acrobats are nothing but patients who have not received such good stable dentures, but they still manage to achieve the stability with those dentures only. So but this situation should not be taken for granted. Conversely, if the patient has poor muscle control, like especially if complicated conditions like senility, parkinsonism, etc., even an ideal fit, so even if the dentures are perfectly fit, then also the patient will live in a situation where she cannot manage the dentures. So the patient education and training are very vital during fabrication of a complete denture. Tongue factor. So tongue is a very important factor because it rests in the mouth, right? So when it is resting in the mouth, what it does, it applies some pressure over the ridges. Okay, so it is very important for denture stability. Previously we have residual alveolar ridges only, right? But on this ridges now we are putting up the denture bases. So when the denture bases and the flanges are there, so the denture stability and retention is also determined by the tongue. So if the tongue retracts upon opening one mouth, it is virtually impossible to obtain a good lingual border seal of the lower denture. Okay, so this is a very important thing. If while opening the mouth, the tongue is retracting, we cannot produce a perfect border seal, because when we are performing the border molding technique in the mandibular denture, we use the pressure from the tongue to achieve the like border surfaces. Okay, so to overcome this, a training groove is made just below the central incisors. So just below the central incisors, what we do a training groove. Okay, so what the patient is instructed to keep the tongue place the tongue on the groove during the denture use, except when eating and speaking. Okay, so most patients can learn to keep their tongue in this correct position in a few weeks. Afterward, the groove can be filled. Okay, so adequate tongue support prevents anteroposterior movement of the mandibular denture and hence adding to the stability. Okay, so let's come to the clinical scenario. So a denture wearer patient attended to your office complaining of unstable lower denture. On intraoral examination, peripheral seal seems to be fine. If you are making a new lower denture, how can you enhance the stability? The peripheral seal is good. There is no problem in that, but still the patient is complaining of an unstable lower denture. So what all conditions you should take care in preparing the new denture now? So the level of the occlusal plane. So if you are making a new denture, should the level of occlusal plane be above the dorsum of the tongue? Should this be the tongue rest on the occlusal surface of the lower teeth? The lingual contour of the denture is concave. The posterior teeth on the denture have a broad buccolingual width. So these are the options they have given. So to make the new lower denture to enhance the stability, what all should be changed? Should you change the level of occlusal plane, or the tongue rest on the occlusal surface of the lower teeth? The lingual contour of the denture is concave. The posterior teeth of the denture have a broad buccolingual width. See, if the patient is complaining of unstable denture, lower denture especially, and you find peripheral seal to be not normal, then you can go for, okay, you can go for these options. The posterior teeth on the denture having a broad buccolingual width, you can do this. Then the lingual contour of the denture making it concave, you can do that. The level of occlusal plane to be above the dorsum of the tongue, is mandatory. Okay, you have to do this. But peripheral seal is good. So there is a problem with tongue. The resting position of tongue is creating this instability. So what we should do, the tongue rests on the occlusal surface of the lower teeth. Okay, so we should be able to make the tongue rest on the occlusal surface of the lower teeth. So we should educate the patient by making a new denture. We should educate the patient how to rest the tongue on the lower denture base without causing the unwanted displacement because of the tongue. Okay, this is what we can do. So if you like our video, do subscribe to our YouTube channel, and you can also share the video to those who want to learn more. And you can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also find us on Telegram. Thank you.